We're talking about men, and we're going to talk about the top 10 leading causes of death in men.
Okay.
Number one is?
Yes, heart disease. Heart disease is the top leading cause of death in everybody. So the wonderful thing about heart disease is that it's completely preventable. We think about 4 major risk factors for heart disease. Diabetes, smoking, high blood pressure, and high cholesterol. Those are still the major risk factors, and each one of those are preventable or treatable. So that's number one. Cancer is obviously very dynamic. It depends upon which type of cancers. Obviously, some types of cancers are specific to men. We'll hopefully talk a little bit about that. Unintentional injuries, that's really, I would say, more prevalent in the younger generation or younger age range of men. I guess we can say unintentional injuries as well in the very, very elderly with falls. But when I read unintentional injuries, I think about accidents, violence, those kinds of things. Obviously, those are more common in the younger age. Chronic lower respiratory disease, again, something that can be preventable. Did smoking lead to that? Did you not get vaccinated? Did you not do your flu shot, your pneumovax, etc.? And then stroke. Stroke is a really challenging one because, again, risk factors lead to the possibility of stroke. Diabetes, diabetic screening is one of the easiest things to test for. Fasting blood tests, it can't get any easier than that. And the numbers are pretty easy to interpret, both for patient and physician. And then the initial treatment for your diabetes may be a whole lot less complex than what that treatment may be when your diabetes has had a chance to elaborate. Suicide is mostly in older men, of course, so the number one sort of demographic that has successful suicide. So we have to be wary of depression in the elderly, of course, and in particularly elderly males. And Alzheimer's is really tough. Alzheimer's is something that is very challenging and is something that has a lot of back and forth as to how, and what is the best way to prevent Alzheimer's. And then the other two, again, preventable things. Chronic liver disease depends whether we're talking about alcohol-associated chronic liver disease or acquired chronic liver disease from hepatitis, those kinds of things. But obesity can lead to that too.